In summary, we continue to face a very highly transmissible variant that is causing a high level of community infection. However, while it is far from harmless, its overall impact is less severe than Delta. So, using the framework I described earlier, we assess the current threat level to be medium. However, assuming the level of infection and its associated impacts, for example hospital admissions, falls or broadly stabilises, we would expect this to be reassessed as low in the period ahead. This has enabled Cabinet to agree this morning an indicative timescale for lifting or converting to guidance the small number of legally imposed protective measures that remain in place at this stage. So I can confirm firstly that the COVID certification scheme requiring certain venues and events to check the vaccine or test status of attendees will come to an end next Monday, the 28th of February. The app which supports the scheme will remain operational, however, so any business that wishes to continue COVID certification on a voluntary basis to reassure customers will be able to do so. Second, as of 21st March, assuming no significant adverse developments in the course of the virus, we expect that the legal requirement to wear face coverings in certain indoor settings and on public transport will be converted to guidance. We will continue to strongly recommend the wearing of face coverings in shops and other indoor public places and on public transport. We also expect on 21st March to lift the legal requirement for businesses, places of worship and service providers to have regard to guidance on COVID and to take practicable measures set out in the guidance. And the legal requirement on businesses and service providers to retain customer contact details is also expected to end on 21st March. Presiding officers, governments obviously must act lawfully, and that means we cannot impose legal restrictions when it is disproportionate to do so. As the situation improves and the severity of the impact from COVID reduces, we are therefore duty-bound to remove legally imposed restrictions. But this should not be taken as a signal that COVID no longer presents any risk to health, because it clearly does. So even though certain measures, for example face coverings, may not be legal requirements in future, we will still recommend voluntary compliance as part of the range of behaviours that will help keep us safe as we manage COVID in a more sustainable and less restrictive way. Presiding officer, let me turn now finally to testing. Testing has been, and it will continue to be, a vital part of our management of COVID. However, as the nature of the threat and our approach to managing it evolves, so too will our approach to testing. It is reasonable over time and barring adverse developments to move away from mass population-wide asymptomatic testing towards a more targeted system focused on specific priorities. These priorities will include surveillance, rapid detection of and response to new variants, effective outbreak management, particularly in high-risk settings like care homes and hospitals, and ensuring access to care and treatment for those who need it. However, it is vital that we make this transition in a careful and a phased manner. So in March, by which time I hope we will have more clarity from the UK Government on available resources, we will publish a detailed transition plan for Test and Protect, setting out our priorities in more detail and describing the scale of infrastructure that will remain in place for the longer term. The plan will also confirm the duration beyond the end of March of any transition period during which the system will operate broadly on the same basis as now.